Clinical features of Hallux valgus is usually very much evident. First and foremost is whenever the patient comes to you, the only most common complaint is always the pain. Pain could be mild, it could be moderate, it could be a lot of severe, it could be associated with certain severe as well. Especially if a female comes to you and complains of pain in the first metatarsal joint or in the first toe, usually the most common complaint is that whenever we bear weight, it starts to having a pain. But sometimes pain may be due to the transverse metatarsalgia. What is it? As the first toe goes into biomechanically wrong kinematics, the load of the body is shifted towards the second metatarsal. As a result, this results in the pain in the second metatarsal, and sometimes the main complaint is actually of the patient is that there is pain which is happening in the second metatarsal, and when you just see the foot, you see the obvious Hallux valgus deformity on inspection. Next is could be associated with the club foot. Usually there's no club foot, but patient may present with a lot of callosities formation which may have occurred over the medial aspect or on the lateral aspect of the foot. Then there may be associated foot deformities as well. Foot deformities, why? Because once the kinematics of the foot is disturbed, this actually results in a lateral subluxation of all the metatarsal heads. Now, when this starts to happen, there may be associated with curly toes or actually the toe deformities, which can be, if you appreciate it over here, with one toe either over or underriding the first metatarsal. Now, this is sometimes the patient may come up with this problem, and actually there may be no pain as well. Then this could be leading to abnormal posture. Why? Because the windlass mechanisms is disturbed due to Hallux valgus, and it actually gets depressed. Therefore, the push off of the foot during the gait mechanism is actually reduced. When this push off is reduced, this results in actually activity related problems, and patient usually complains it's difficult even to walk for a longer period of time. Especially when he or she actually walks, this results in increased back pain, hip pain, as well as the knee pain as well. Why? Because whole kinematics of the gaits has been disturbed. Then there may be associated with heaviness in the leg, especially because there is associated gastrosoleus complex hyperactivity, or actually gastrosoleus complex contraction results in heaviness of the leg, especially when they walk for a longer period of time. And then they may be associated with problems like ingrowing toenail and multiple infections of the big toe. Why? Because sometimes the phalanges go under the toe or above it, and this results in actually a lot of sweat collection, and there may be fungal infections which may occur off and on over this area, and this is actually secondary to this problem. The main thing is that once the kinematics is disturbed, this results into pain. Pain may be underlying due to the problems with the first metatarsal head. There may be problems with the second metatarsal due to transverse metatarsalgia, or there may be associated with arthritis of the metatarsophalangeal joint as well. And all this further activates when the patient walks on the same foot. This leads to foot deformation, abnormal posture, heaviness in the leg, and even the problems like ingrowing toenails as well. And these all could be present when present as a symptom of the Hallux valgus. But when you assess a patient of Hallux valgus, what you need to look at is, first, is there obvious deformity of the hallux or not? Then you have to assess about the mobility or the pain and the tenderness at the metatarsophalangeal joint. If there is arthritic changes in the metatarsophalangeal joint, the pain and tenderness would be present in the first metatarsophalangeal joint. The second most important is you have to assess the mobility of the tarsometatarsal joint, as it's a complex problem involving the whole ray. This leads to hypermobility of the first tarsometatarsal joint as well. And then you have to look at foot as a whole. You have to look at the forefoot, other metatarsals, as well as what are the situation of the phalanges as well. Then look at the midfoot, not only hypermobility first metatarsal joint, but also look for other problems or callosities of the midfoot as well. And then go for the examination of the hind foot as well. Why? Because there is increased actually hyperactivity of gastrosoleus muscle, and this may be leading to more of a plantar flexed hind foot are tend to actually tightening, which may be seen in these patients as well. Therefore, when the patient comes to you with Hallux valgus and pain may be the only predominant symptoms, you have to assess this patient as a whole. Not only take detailed history and all the symptoms which are actually happening, along with that, examine the forefoot, midfoot, as well as the hind foot, and assess the gait of the patient as well. And also rule out problems related to the knee as well as the hip joint.